I'm just going to talk to you briefly today about some of the work I did during my PhD on the initiation of bone lesions in young pigs, thanks to a model that, as Pedro mentioned, we accidentally bumped into. So just a quick outline, some of the insights from the hypovitaminosis D kyphotic pig model, as we've termed it, a brief overview of endochondral ossification, and then I'll get into some of the molecular signals that we've begun to look at. In lieu of time, I won't be able to show you all the data, but hopefully enough to tell a good story. And then just some general conclusions that we have on some of the nutritional inputs on bone lesions. So as some of you may have seen previously, this is our hypovitaminosis D kyphotic pig model. It's a little difficult to see, but this humpback condition, which is very obvious up here in the DEXA scans. The main point I want to get across to you with this model is this is induced by leaving the vitamin D out of the maternal, gestation, and lactation diets. So we really emphasize and focus on the maternal effect and begin to wonder how early some of these lesions we see that lead to lameness really do start. So here is one of the most recent studies we did looking at the kyphosis incidence. And I'll just orient you to our experimental design that we've used over the past 8-9 years in order to reproduce this problem. If you look on the x-axis here, we have 3 different maternal diets: no D, no supplemental D, plus D, which is 325 international units, and plus D, which was 1,750 international units fed during gestation and lactation. And those would have started on day 1 of breeding. And then pigs were weaned at about 3 weeks of age and then put onto one of 4 different nursery diets. They consisted of either no D or plus D at 200 international units, and then each of those with either low or high calcium and phosphorus diets. Low calcium and phosphorus diets was 75 and 95% of the calcium and phosphorus requirements respectively, and high was 150 and 120% calcium and phosphorus percentages of the requirements. So this right here is actually, and I should say that was a 4-week nursery trial. So by the end of the nursery trial, the pigs were roughly 7 weeks of age. So kyphosis incidence, we don't see the gross abnormality like I showed you in the slide before until, if you use your imagination, 9 weeks, but really as subjectively objective as we can get at 13 weeks. So on the y-axis is the percentage of animals with kyphosis in their respective treatment groups. So this was animals at 13 weeks of age, and obviously the big take-home message here is pigs produced by -D sows had roughly 20 to 55% incidence of kyphosis within those respective nursery treatments. And as you can see, obviously decreasing with maternal dietary vitamin D. And just a reminder, this is 13 weeks of age, so that means these pigs have been on normal dietary conditions up at our unit for 6 weeks post-nursery. And we're still seeing these effects due to maternal diet during gestation and lactation. So this is kind of our functional endpoint, right? So a gross, obvious deformity, bone issue. We have some DEXA scans. I'm not going to share that data with you today, but then we began to think and look a little bit more, dig down deeper and get more to the molecular and what's going on at the local bone. As you saw, the main deformity was in the vertebrae. And what causes kyphosis is actually wedged vertebral bodies. So the bottom portion of the vertebral body here becomes wedged. And if in the human world, the definition of kyphosis is 3 or more greater vertebral bodies wedged 5 degrees or greater. However, the vertebrae were not the only bones we were seeing issues in. At a gross level, when we opened up the femurs and looked at the growth plate regions, we were also seeing very abnormal growth plate widths, as you can see here in the -D group, a wider, irregular growth plate as compared to the more organized plus D group. So more recently, we've been able to dig even further into some of the more molecular processes that are occurring. And we've teamed up with an orthopedic surgeon at the University Hospital because kyphosis is an issue in young children. And so he's interested in using it as a model for children. But with his help, we've done some histology. And I understand these slides might be a little hard to see with the lighting, but Dr. Matt Holansky was generous enough to let me use these slides. But what this shows is a control pig over on the left-hand side with H&E and trichrome staining, and then a kyphotic pig on the right-hand side. So big take-home message here is you can see the irregularity in the growth plate of the kyphotic pig as compared to the control pig. And when we look at the trichrome staining to look at the cartilage, you begin to see this retained cartilage. So what another important point we like to make with the kyphotic pig model is it's not just a model for kyphosis, but we clearly have bone lesions that can affect other bones like the femur that don't just lead to that abnormal humpback condition. So as we began to think about what could be occurring here, we think that this provides evidence of uncoupled endochondral ossification. So just to briefly go through endochondral ossification as a review. So within the growth plate region here, there's different zones of cells, different zones of chondrocytes, which are these green cells here, or cartilage cells. So on top is a resting zone, then the proliferative zone where the cells begin to replicate, and they begin to form these columnar organization, which is extremely important in normal growth plate development and turnover. Then we move into the hypertrophic zone where, as the name implies, they begin to grow in size but maintain this columnar organization. And then right here at this point, what we often call the chondrous osseous junction is where we have invading capillaries, which will bring osteoblasts and osteoclasts with it to lay down the bone and begin to mineralize. So understanding the general process of endochondral ossification and trying to equate that with the gross abnormalities we see in the spine and the femur of these pigs, we began to think which of these signaling pathways could be altered in our model that could induce such bone abnormalities. So there's a multitude of factors involved in endochondral ossification and matrix turnover, and just the complexity of the growth plate in itself, having all those different zones. Each cell is going to react to different signals in a unique manner. But some of the more important factors in bone matrix turnover are the matrix metalloproteinases. And two that we decided to focus on were MMP9 and 13. MMP9 is a gelatinase, and 13 is a collagenase, so they're going to degrade different proteins within the extracellular matrix. And just an interesting, from a nutrition standpoint, point that I want to make is that these are zinc-dependent enzymes, and not just in the classical covalent way that we think about. They are required for proper enzymatic activity of these MMPs. Another factor that goes hand in hand with the MMPs is VEGF, or vascular endothelial growth factor, which is a chemoattractant for angiogenesis. And just to kind of orient you to where some of these signals are released from within the growth plate, the VEGF and MMP13 can be produced by hypertrophic chondrocytes, which also produce type 10 collagen. The reason I show you the collagen there is to show you why there's different signals necessary within the growth plate to break down the different types of collagens and extracellular proteins. MMP9 is produced by the osteoclasts, and then VEGF and MMP13 can also be produced by the osteoblasts. So like I said before, it's important to begin to understand where each of these signals are occurring so that if we know which signals are breaking down, we can determine which process of endochondral ossification might be breaking down in this model. So to give you a little schematic of how these three proteins work together. So VEGF is produced, as I said, by the chondrocyte and the osteoblast, released into the extracellular matrix. That VEGF that's released is inactive. It needs to be, the extracellular matrix needs to be broken down in order to release that factor to allow it to do its job. So the MMP13 and 9 produced by the osteoblast and osteoclast will be released, and go to work on the extracellular proteins to release the VEGF, which will then allow for angiogenesis, which again brings along those osteoclasts and osteoblasts for proper endochondral ossification. So after digging and learning about what these particular proteins do, just keep in mind there's 21 or 22 MMPs, so these are not the only ones. Our initial hypothesis was that there would be a decreased expression of the femur vertebrae MMP9, 13, and VEGF mRNA in our hypovitaminosis D kyphotic pig model, so the pigs that were produced by the -D sows. The reason we measured mRNA is there's evidence that these proteins are controlled transcriptionally. And the reason, I guess, I just assumed that they would be decreased is a caveat I think we all fall into. When something's wrong, we must be missing something. So we did some quantitative PCR work. I'm just going to show you one graph for time's sake. But this is femur relative MMP9 mRNA expression. And again, on the x-axis are the 12 different dietary treatments. And on the y-axis is the relative fold change. So big take-home message, if we average across all the nursery treatments, is pigs produced by +D and ++D sows have about 25 to 50% of the expression of our pigs produced by -D sows. So our initial hypothesis was wrong. And so, as stubborn as I can be, Tom tells me, I decided to dig a little bit deeper into the literature to see what I missed. And I got reading some of the papers on the articular joint diseases, and a lot of those papers are in humans, horses, and dogs, because they all suffer with horses and canines, especially with lameness issues, much like pigs do. And this is a very generalized summary of all those papers, but in general, those MMPs were increased, not just 9 and 13, but some of the other ones that may be playing a role. So this data would coincide with what we saw in our preliminary MMP9 mRNA data. And so I say preliminary because we don't really have it all worked out yet, but it's a start. And some of these papers actually will measure the MMPs in serum and synovial fluid, so we have to work towards hopefully being able to use them and or other regulators of those proteins as biomarkers. I put up here TIMPs. So just as endochondral ossification is what I call a balancing act of bone formation and degradation, TIMPs balance out the MMPs. So tissue inhibitors of metalloproteinases are endogenous negative feedback regulators of MMPs. So that is also an area where we could begin to look. So as I said, balance, as I've learned through my graduate training as well as I continue to learn now, is key. What I said before when I figured there was no MMPs and that's why we had a problem, kind of opposite of what we think. We have too many MMPs. We're dysregulating the endochondral ossification process. So endochondral ossification, MMPs and TIMPs, calcium and phosphorus, all examples that we really have to balance those factors when we are thinking about nutrition and production. So in conclusion, it's complicated. I didn't get away with saying that at my PhD defense, but it is. Carryover and maternal nutrition is important in neonatal bone health. I've hopefully been able to show you that at both a gross and a more molecular level. Nutrients can act locally, not just systemically, to couple endochondral ossification. So those proteins, I didn't quite get into some of the vitamin D signals that actually can occur within the growth plate because those cells do have the receptors. Systemic circulation isn't always the best predictor of what's happening locally at some of these tissues. Nutrient interactions on molecular signaling bone are not clearly established, especially in the pig world. A lot of the literature I have to dive into, as I said, is human, horse, and canine, and mouse. And the kyphotic pig model, in our eyes, provides a tool to understand the initiation of bone lesions, as I said, in general, not just of the gross kyphotic lesion, but what's happening in the femur. And I think we really have to start paying attention to what we're feeding our sows during gestation and lactation, because I think once we get out later to when these gilts and whatnot are becoming lame, we've missed the boat as to when the problem actually occurred. And as I said, balance is key. So with that, I'd like to thank some of our SRT staff, Tom, and some lab support, and I'd be happy to answer any questions.